Morning, Joelle.
Morning.
Hi, Larry. How's it going? Pretty good today, Jim.
Thanks. Acute myocardial infarction, or AMI, is a condition also known as heart attack, where a patient has a clot in a coronary artery that is preventing adequate blood from reaching the heart muscle. When AMI is occurring, part of the heart tissue is dying from lack of oxygenated blood. Among patients experiencing AMI, some patients have ST elevation myocardial infarction, or STEMI, and some do not.
And the differences between STEMIs and non-STEMIs relate to the clot. STEMIs tend to have a bigger clot, a complete occlusion or near complete occlusion. That clot tends to be more mature with fibrin. Non-STEMIs, it tends to be more of a partial occlusion, and the clot itself is composed primarily of platelets. So that has treatment implications because the treatment that STEMI responds best to is immediate reperfusion, and a medical management is an acceptable approach for the non-STEMIs.
Larry, are you okay?
I don't know.
You want... Are you sure you're all right?
Yeah, there just must be something going around.
Do you want me to call someone? I'm trained to help.
It's my chest. It hurts a little bit here.
This is Joelle. Call 911. We have a member with chest pain.
Larry,
So the purpose behind finding ST segment elevation is it's identifying patients that have that bigger, more mature clot that need immediate reperfusion and is very time sensitive. So the earlier you identify the STEMI, the sooner you're going to get them reperfused, thus the reduction in mortality.
A 12-lead electrocardiogram, ECG, is a graphical representation of the electrical activity of a person's heart. It produces a waveform that a qualified provider can interpret to determine whether a patient is STEMI or non-STEMI. In the past, 12-lead ECGs were only used by physicians to recognize AMI and to determine subsequent treatment decisions.
Sir, we hear you're having some chest pain. Let's get you laying down here so we can take a look at you.
Today, EMTs must be able to place a 12-lead ECG, and paramedics should be prepared to interpret the reading to make a determination on a patient's condition, appropriate transport, and treatment.
Hey there, so what can we do to get you more comfortable? I have this towel here. Can I put this behind your head?
Absolutely.
Can I help at all?
We're going to go up and do paperwork. If you'll just hang here.
yeah.
If you had to rate it on a scale of 1 to 10, where would you put it at right now?
About 7 or 8.
From a field perspective, while it's possible to suspect a heart attack without a 12-lead ECG, and you can do that based on the clinical presentation, just because you suspect a heart attack, you have no idea whether or not this is a STEMI or a non-STEMI. And the only way to make that decision is with the 12-lead ECG.
Let me go ahead and get set up for a 12 lead.
And that's just another point, is that the purpose of getting the 12 lead is not only to confirm your suspicion of AMI, but beyond that, to determine whether or not ST elevation is present, and if so, then to guide them to the appropriate treatment.
As an EMS responder, you can improve the likelihood that your patient receives the proper treatment at the most appropriate facility by reviewing the basics of 12-lead ECGs.
All right, so we're going to give you some oxygen, hopefully get you feeling a little bit better, okay?
Gonna have to cut your shirt off, okay?
This program provides a review of how to acquire a clear waveform from a 12-lead ECG, primarily for the purpose of identifying STEMI,
Be all that comfortable, okay?
and how a paramedic can rule out other conditions that can cause ST elevation that are not STEMI.